Leprosy is often associated with biblical times, during which a leper wasn't allowed to come within 6 feet of any human being, including members of his own family. The disease was considered so revolting that the leper wasn't permitted to come within 150 feet of anyone when the wind was blowing. Despite reports to the contrary, leprosy still poses a challenge in the country. A Lupe hospital, situated in Teso district, Busia County, Western Kenya, was established in 1947 and is a referral center for those suffering from the disease in East Africa. Now, it's a home to these leprosy patients who have been neglected by their families. Safiri Juma has been living with leprosy for 56 years. He remembers vividly how the disease started.
Aliangulia kutoa nini hapa? Kidonda alafu tena natoa hapa. Kapeleka mimi mpaka Masambweni. Enda katibu huko. Katuma mimi mpaka hapa Lupe.
And while medical advancement and monitoring programs have largely eliminated leprosy from the list of public health threats, the stigma associated with the disease remains.
Oni wanagombana ati wataki kukana huko Mkoma, singa kaa nyumbani. Iko eka karibu eka 10 mimi natoroka tu. Sauri ya ugomvi. Ati wewe pia ni mtu mwenye anaongea na watu. Ndio naomba sikuhangaika nje namna hii.
Najua huko kwetu hii ugonjwa hakuna. Sasa watu wapendi sana. Hata kukula na watu, ukule na watu.
Despite stories done to highlight their plight and fight stigma, the situation remains grim.
Nyumbani shida ilikuwa mbaya nyumbani. Kama bibi yako hakuna watu la kudarau, kwa maana bibi naye alienda. Alitoroka sauri ya ugonjwa. Na watoto pia wanafuata, iko na watoto yake 2 huko.
Sasa wakati ugonjwa alinishika, akatoroka na watoto mpaka wa leo.
They have no jobs, no assistance and little food.
Shida iko hapa njaa. Pako bebe jembe ndio kule.
Si mkuu ni mbaya kwa nikienda kulema anaumisanga.
For them, even the smallest task like eating can be difficult.
Hata kukula ni shida. Kulala pia ni shida hata kama unaingia kwa nyumba. Nalala tu juu ya mawe.
In the past, people were called to so-called lepers colonies to curb the spread of the disease. But the people here came of their own accord. Samson Kurkat left his home in Eldoret 44 years ago to seek treatment.
Siku hiyo ilikuwa mkono mbaya, uso ulikuwa mbaya. Bas nikakuja nikafika hapa saa 12.
Leprosy is caused by bacteria, and those affected by the disease need proper medical management of skin lesions, which is expensive for these patients who can barely even afford food. Fortunately for them, the leprosy is not contagious, thanks to past treatment.
And because it's not healing quickly, he approaches the ulcer from top here.
Francis Amakoye, a senior occupational therapist at a Lupe hospital, says the disease has reduced drastically over the years due to the medication available.
Before 1985, we were treating leprosy for life. But after 85, when the WHO introduced MDT, we are able to treat leprosy for a maximum period of 1 year.
He asserts that leprosy is airborne and can be transmitted through sneezing if the patient has not been injected.
When somebody who has low body immunity and is exposed to somebody who has or is coughing a lot of bacteria in the air, the one who has low body immunity will definitely contract the disease. But it's the body that will determine whether he'll suffer from the disease at long last or not.
Dr. Makoy dismisses beliefs about the disease, saying it's a condition like any other, and that poverty, ignorance, and beliefs about the disease had spurred its rapid spread.
Now, it is being directed that leprosy is a disease for the poor because of one thing. The poor people, because of the economic status, we don't eat well. But look at the people who are eating junk food. Right now, they don't have good immunity. They can contract the disease. So it is your body immunity that is determined by the type of food you eat. So if you eat poorly, you'll get some of these diseases. So leprosy is not for the poor, such as for everybody.
While fears of the disease reoccurring remain far-fetched, recent research, however, indicates that leprosy is now reoccurring in children below the age of 2.
So our worry is, if this leprosy can come back or can reoccur again, how shall we prevent it? So we are really a worried group of people.
Just what are some of the signs of this disease?
If you feel numbness, 2, you feel tingling sensation. The infiltration of the skin will actually make you run to the hospital because you start looking like a lion or a lioness. You start losing, your eyes start becoming red. You start tearing. You start having a hoarse voice. You start ending up with the earlobes getting, and they start hanging. So that one raises a concern.
Kenya's forgotten lepers trudge on with lives, hopeful that with advances in modern medicine, their lives will be much better than lepers in the decades gone by. They remain optimistic that stigma against them will fade and allow them lead normal lives. Asli Galgalo, Citizen TV.